Binswanger disease and neuronal linkage. Binswanger disease, also known as subcortical arteriosclerotic encephalopathy. It's a progressive form of vascular dementia caused by damage to deep white matter of the brain due to chronic high blood pressure and other vascular risk factors. Core concept: chronic small vessel disease, loss of myelin sheath, and axonal disconnection. That is a learning map. Clinical focuses, diagnosis, treatment, prognosis, and graphical summary. And key link: small vessel ischemia, white matter injury, neuronal network disconnection. Disease description. That is a definition which I already told you. Core pathology: preventricular and deep white matter lesions, lacunar infarcts, myelin loss, and axonal degeneration. That is the clinical identity. Clinical identity is very important. Some pathologists view as a severe hypertensive microangiopathy or even a misdiagnosed form of CADASIL, that is the small genetic vessel disease. Major clinical features: slow thinking, poor attention, impaired planning, memory loss, apathy, depression, gait disorders, falls, and urinary urgency. Symptoms may worsen stepwise if lacunar infarcts or recurrent ischemia episodes occur. That is the key neurological idea. Etiology: vascular triggers, chronic hypertension, atherosclerosis, diabetes mellitus, hyperlipidemia, smoking, and aging. Small vessel disease: hypohydrosis, fibrosis, endothelial dysfunction, and luminal narrowing. Predisposing factors that include the full blood pressure control, metabolic syndrome like diabetes, sleep apnea, and chronic inflammation. These are the risk factors: arterial wall injury, reduced perfusion, white matter ischemia, and neuronal disconnection. That belongs to axons and axonal connection. That is the etiological summary. Disease mechanism: small vessel lipohydrosis, chronic hypertension or hyperperfusion, oligodendrocyte injury, axonal disconnection. Final outcome will be diffuse white matter injury, produce executive dysfunctioning, gait disorder, mood changes, urinary symptoms, and vascular dementia. Neuronal mechanism: white matter tracts, myelination of axon can be degenerated, and the signals between the cortex, thalamus, basal ganglia, cerebellum, and spinal cord get lost. Demyelination: injury removes myelin insulation, slowing poultry production and impairing time. Network failure: that is the summary of neuronal linkage cascade. Small vessel ischemia, oligodendrocyte injury, myelin loss, and axonal degeneration reduce connection velocity. Cortical, subcortical disconnection, dementia, gait dysfunctioning, and mood symptoms are the major symptoms. Frontal subcortical circuits, executive dysfunctioning, poor planning, slow thinking. Corticospinal pathways, weakness, spasticity, gait disturbance and falls. Basal ganglia, bradykinesia, rigidity and Parkinson features. Thalamocortical pathways, attention deficit and reduced information process. Apathy, depression, and emotional liability. Urgency and urinary incontinence. These are the key points. It's a white matter disconnection disorder rather than primary cortical neuronal loss disease. Clinical suspicion, MRI of the brain, vascular risk profile, differential diagnosis, and diagnostic formula. If the patient having the cognitive decline plus vascular risk factor, then MRI should be there. Exclusion of the mimics, and that leads to the Binswanger disease diagnosis. Treatment, strict blood pressure control, diabetes management, lipid lowering agents, smoking cessation, and exercise. Cognitive support, cognitive stimulation, structural routine, medication review, treat sleep and fatigue. Stroke prevention, mood and behavior, rehabilitation, and bladder and safety. That is the treatment goal of Binswanger disease. General prognosis and better prognostic indication, early detection, controlled blood pressure, fewer Lacunar, good mobility, strong rehabilitation, and absence of recurrent stroke. These are the poor prognostic indication and clinical outcomes. That is the graphical summary of Binswanger disease. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.